In the Philippines, especially in the poor rural communities, youth aged 10 to 19 are believed to have had a premarital intercourse, which qualifies them to become a young parents. Pregnancy in adolescents is a serious issue for a variety of reasons. It is one of the most relevant issues not just in the Philippines but also around the world. Most of these teenagers are unsurprised by their parents, which causes them to make rash and improper judgments. Becoming a teen parent can be difficult not only for the infant, but also for the juvenile parent who will likely face social, health, and societal imperfections, as well as increased chance various medical difficulties, such as early labor and social ramifications. With that, teenage pregnancy causes a slow of social, emotional, and medical issues. Despite improved sexual health awareness and condom usage in nations such as Philippines, relevant factors such as low education levels, poverty, and incorrect sex knowledge among teenagers contribute to teenage pregnancy. Some poor countries confront issues such as early marriage and a lack of knowledge about contraception, both of which lead to adolescent pregnancy. Because unexpected sexual intercourse is more prevalent in girls aged 12 to 14 who are unaware of protect sex. The worry for younger girls who become pregnant is considerable. If a teenage girl becomes pregnant at such a young age, abortion is one option to explore if the pregnancy is recognized and diagnosed in a timely manner. Adoption of community support to raise the kid are some options to aid the adolescent pregnant emotionally and also if she is financially unable of caring for a child in circumstances where a girl is in later adolescence. It is critical to obtain assistance from the girl's parents or the father of the expecting child so that adequate prenatal care may be provided. It is critical that adolescent moms avoid smoking, drug use, and other risky behaviors. Teenage moms may be undereducated and aware of measures that must be followed during pregnancy. It is so critical to provide educated and commonly assistance to such young girls as well as raise knowledge about contraception in order to keep them safe from such experiences in the future. Childbirth among adolescents is often a difficult moment for parents who have hope for a bright future for their children. However, because the adolescent who becomes pregnant also experiences feelings of anger and irritations for the circumstances has arisen. It is critical that parents keep their anger and under control in order to decrease the adolescent's stress. The parents should have their kid have a thorough physical examinations by a trained physician in the area. And they should also guarantee that she receives outside therapy if necessary to cope with mental stress. It is preferable if both the girls and boys' families are prepared to appropriately raise the child. Otherwise, adoption should be considered as a method with a suitable organization chosen to adopt the kid. Teenage pregnancy is not socially acceptable in many groups and cultures. Those social issues must be addressed in addition to medical and prenatal treatment for the pregnant young girl. Children born to adolescent parents are more likely to struggle with a decent education since social support may be lacking in their case. Such children can acquire quality education and become self-sufficient members of social if proper commonly support is offered, such as child care, help, and social services. Teenage pregnancy is unquestionably harmful for the female child, who is typically exposed to societal and familial pressure as a result for the indiscretion that lead to her pregnancy. If a teenage girl faces hostility from friends and family, she is unlikely to grasp and know the nutritional elements of pregnancy and may give birth to a kid who is underweight and malnourished. It is critical that such adolescent parents return to school after giving birth to their kid so that they may be educated on how to be better parents in raising their children. Child care should be available and affordable to underage men. If they were abused as children, many adolescent parents start abusing their children as young as 6 months old. Furthermore, adolescent pregnancy is related to increased risk of mortality for both the mother and the child. As a result, early prenatal care is critical to saving both the kid and the mother from the problems or dangerous medical disorders. With that, teenage pregnancy prevention programs such as abstinence education, knowledge-based programs that teach them how their bodies, clinical focus programs for easier access to sex education, and peer counseling programs are such a few of the measures that can help control the world's teenage pregnancy rates. Thank you.